Hi everyone, welcome to UWorld's Next Gen NCLEX review. We are so happy to have you all back today. My name is Samantha, I am a nurse here at UWorld, and today we're going to be covering oncology questions. So what to expect if you haven't joined us before. I'll read the questions out.
Welcome to
UWorld's
today.
Next Gen
I'll go ahead and
NCLEX
give you about
review.
30 seconds or so to drop your answers
into the chat, which my name is Samantha, I am a
and then I'll
nurse
reveal
here
the
at
correct
UWorld,
answer.
and we'll walk through the rationale together, why each answer was correct and why the others were incorrect. So we have the fabulous nurse Oncology moderating for us today. Go ahead and drop your questions, your comments, and of course your answers to today's questions into the chat so we can respond and interact, which makes this so much more fun. With that being said, go ahead and share the session, give us a follow, and with that being said, let's go ahead and get started. All right, question number 1. So here the nurse is caring for assigned clients. The nurse should first assess the client who has: 1 is acute myeloid leukemia, is receiving chemotherapy, and is reporting alopecia and anorexia. 2 is esophageal cancer, is receiving external radiation therapy, and has warm red skin on the neck. 3, aplastic anemia, is scheduled to receive 2 units of PRBCs and is reporting fatigue and pallor. Or lastly, 4, Hodgkin lymphoma, is scheduled to receive chemotherapy and has distended neck veins. I see Petro says hello. Hello, welcome. We're so happy to have you here. I think I've seen you here before. Happy to have you back. And with that being said, drop your answers in the chat. Let us know what you all are thinking. Also, keep letting us know what you think of these times that we're doing. So this is a normal timed live, but we've added a lot of evening lives. We'll do one tonight with Nurse Andrew, and then again at 7 p.m. on Friday as well as Sunday. So we know a lot of you guys are busy in the daytimes, whether that's with school or work. We want to make sure we add plenty of times to where everyone can join in. So let us know if you like the evening time, and let us know if there's other times you want us to add in. I'm always looking for an early morning, early bird kind of thing. So let us know if you guys want to see that. Alrighty, lots of great answers. Way to go, you guys. Someone passed their NCLEX on the 4th of July. That is a very patriotic day to pass. Way to go. Congratulations. And I see a couple of different answers. It looks like it's a blend of 3 and 4, but our correct option was option number 4. So way to go to all you guys that got this right. So this is hinting at something called superior vena cava syndrome. This is an oncological emergency. It occurs when an obstruction like a tumor, and we know we have Hodgkin lymphoma here, compresses on the superior vena cava that prevents blood flow back to the heart from the upper region like our head and our neck. So key findings of this is going to be distended neck veins, as well as facial and upper body edema and dyspnea or shortness of breath. So these are associated with superior vena cava syndrome, which is why it's our priority, and we should first assess this client. Without quick intervention, this can be life-threatening. Options 1, 2, and 3 are going to be expected findings rather than complications. So we expect a client that's receiving chemotherapy to lose their hair and lose their appetite. We expect a client that's going to have radiation therapy. We're going to see some warmth, some redness, some irritation on that skin. And lastly, anemia. These clients are going to be fatigued, they're going to be tired, and they're going to be a little bit, that pallor gray skin color. So all of these things are expected findings, which is why they're not our priority. And the thing that denotes a complication and threatens those ABCs is of course going to be our priority. Alrighty, moving on to question number 2. And I see a couple of you guys saying you're having trouble seeing. I will move to the side. It's probably my big head. Question number 2. The nurse is observing a staff member administer medications via a gastrostomy tube or a G-tube to a client with esophageal cancer. The nurse should intervene if the staff member is observed, flushing the G-tube with water before and after administering medications. 2, placing the client in a semi-Fowler position prior to administering medications. 3, instilling a carbonated beverage to dissolve an obstruction in the tube. Or 4, clarifying the prescription for an extended release medication. Alrighty, it looks like maybe the question is being cut off, so we can adjust that to make sure we can see it. It looks like it's on TikTok that we're having the issue. But give us a second and we will work with it. Some of these questions today are a little bit long, so. Alrighty, well, despite that, I see lots of great answers. Way to go, you guys. Doing great. And my favorite question to ask, who here has recently taken the NCLEX? Do we have any new passers? Let us know so we can congratulate you. Also, let us know if you have it scheduled coming up soon so we can wish you good luck. That is so exciting, making that first step in your nursing career. You guys are going to do great. Shea Butter Gangster is taking it soon. Good luck. That is so exciting. Stay calm, be confident, you can do this. Tiffany took theirs the past December and passed. Congratulations. Venus, who's a student nurse senior, is taking it in September. Good luck. And Leanna says she's used a doctor, used Diet Coke to unclog a G-tube. That sounds like something that was maybe not in the hospital policy. Alrighty, so lots of NCLEX testers, new passers. Congratulations to you all. Congratulations to all of our new grads, and good luck to everyone that is about to take that NCLEX. You guys are going to crush it. You're in the right spot. So our correct option here, it looks like most of you guys were on the correct path, is option number 3. So in this case, the client with esophageal cancer, a lot of times our stomach route is going to be impaired or obstructed, maybe from a tumor or irritation from that radiation. So a G-tube placement, really common intervention here for these clients. Essentially, a G-tube is going to be a tube that goes directly into the stomach, so that part of our upper GI tract kind of gets skipped or surpassed, so to speak. We can give feeds or meds straight through this into the stomach. So in terms of what the question is asking, we're looking for something to intervene on. So an action that's incorrect, that's concerning, or could cause harm to the clients. Carbonated, sugary, or acidic liquids can worsen a blockage that already exists, and it can also lead to the breakdown of that G-tube itself. So we would need to intervene if we saw this one. Option 1, we would want to flush that tube before and after to keep it clear, keep it patent. We do want to place the client in a semi-Fowler position. This makes sense. And lastly, we always want to clarify prescription for ER medications. We don't want to crush those extended release because that's not the intended route. They're supposed to have a longer duration. And so if we crush that up, we kind of miss the purpose there. So we would always want to clarify those medications. So option 3 was correct. Way to go, you guys. All right, question 3. The nurse is caring for a client who requires neutropenic precautions. Which of the following actions should the nurse take? Select all that apply. So our options are to administer the intranasal influenza vaccine to the client, place a surgical mask on the client during transport, remove fresh flowers from the client's room, instruct the client to bathe daily, or assign the client to a private room. So our first select all that apply. And it looks like someone takes their NCLEX in an hour. Good luck. Oh my goodness. Another one takes theirs at 1 p.m. My gosh, good luck, you guys. You're going to do great. Stay calm. You got it. Alrighty. And a couple new NCLEX takers next year as well as this September. It seems to be a lot in September. Alrighty, and if you guys have not already, go ahead and check out uworldnursing.com. It's like our home base for all of our UWorld social nursing efforts. We have a calendar for all of our lives, the times, the topics, and the channels that we plan to go live, so you never miss an important topic that you want to learn more about. It also gives you a link to our product, a link to our free trial, as well as some prevalent blog posts that will answer some questions that we get a lot. So make sure you check out uworldnursing.com. It's a really great resource for all of our NCLEX preppers that we have here. All right, lots of great answers. And I see mostly correct answers, but let's check out what the correct one was. So we're looking for everything except for option number 1. So 2, 3, 4, and 5. So we're talking about neutropenic precautions. So bone marrow suppression or myelosuppression is an adverse effect of systemic chemotherapy. It will lead to decreased production or depressed production of bone marrow components like red blood cells, white blood cells, platelets, all of that good stuff that we want. So decreased circulating white blood cells is otherwise known as neutropenia. Clients with neutropenia lack a lot of white blood cells. They're going to be at an increased risk for infection because neutrophils, or those mature white blood cells, are a critical component of our immune systems to help respond to invading pathogens and bacteria and the stuff that we want to fight off. So neutropenic precautions typically are implemented with the clients who have an ANC or an absolute neutrophil count that is less than 1. 2 through 5 are appropriate. We want to place that surgical mask on the client during transport to protect them from anything they could be exposed to outside of their room. Fresh flowers are beautiful, but they also harbor a lot of bacteria and a lot of fungi that could infect the client. 4, instruct the client to bathe daily. This is also just kind of like a hygiene thing. We want to make sure they're clean and they're bathing continuously. And we want to assign them to a private room so they're not exposed to any other types of infection or bacteria. So option number 1 was incorrect. We do not want to give a live vaccine, and that intranasal influenza vaccine is live, to an immune compromised client. So 2, 3, 4, and 5 were our correct options. Great job, you guys. Alrighty, the nurse is teaching a client who had radioactive iodine therapy 1 hour ago. Which of the following statements by the client would require follow-up? So I should avoid contact with my 3-year-old child. 2, I should flush the toilet 2 to 3 times after each use. 3, I will ask my spouse to disinfect our shared bathroom daily. Or 4, I will wash my clothing separate from my family's clothing. So again, it's a follow-up question, so we're looking for an incorrect statement. Go ahead and drop those answers in the chat. Let's see what everyone is saying. And a couple more testers in August 7th. That sounds like a lucky day. If you haven't already, we also now offer a question of the week feature. So a lot of you guys are probably familiar with our question of the day, which we put out every single day on our social media. We also have a question of the week feature, and again, you can access this at uworldnursing.com. If you sign up for it, it sends a question every week straight to your inbox. That gives you another chance to learn more about the UWorld style of question, the NCLEX style of question, and we do provide a UWorld rationale to go along with that, so you can see why the correct answers were correct and why the incorrect answers were incorrect. So make sure you take advantage of that. A lot of free resources for you guys, so make sure you take advantage of those. Alrighty, and I see almost entirely option number 3. So way to go, you guys. That's what we were looking for. When we're talking about radioactive iodine therapy, we can use this in the treatment of hyperthyroid, for example, but it's imperative to keep certain safety precautions to keep the clients, their loved ones, as well as the healthcare team safe. We want these clients to sleep separately from others, and we want them to use a separate restroom. So disinfecting is great, but we don't want them to be sharing a bathroom with their spouse. So that's why option 3 would require intervention. Other things that we want to do is after using your separate restroom, we want you to flush that toilet 3 times just to get all of that material that you're excreting out and away from the home. Don't share kitchen utensils. Wash your clothes separately from others, which includes bedding. And for our childbearing populations, avoid pregnancy 4 to 6 months after the use of radioactive iodine. So again, 1, 2, and 4 are indicated. 3 would require intervention. So that's why it was our correct option. Alrighty, so again, I see a couple questions about this. It's not about the disinfecting, that's not why that's wrong. It's about the shared bathroom is what we're worried about here. Alrighty, question 5. Y'all are doing great. So the nurse is teaching a client who is receiving external radiation therapy about skincare. Which of the following information should the nurse include? Select all that apply. Should we alternate application of cold and hot packs to the affected area to manage discomfort? Do we want to wear a wide brim hat and long sleeve clothing when spending time outdoors? Should we apply lotion recommended by the healthcare provider to the affected area? Keep the affected area covered with a compression garment? Or lastly, 5, exfoliate the affected area with a washcloth while bathing? Drop those answers in the chat. Let's see what you all think. Also keep letting us know how you all like to study. Are you using a Q bank feature, a question bank feature? Do you like flashcards, workbooks, live reviews? What do you like to see? How do you like to study? I know everyone learns differently. For me, I'm a visual learner, but I know that varies from person to person. So let us know how you all are studying for the NCLEX especially, but even if you're still in nursing school, let us know how you like to study for your class curriculum. Lots of great answers coming in. Again, it's a select all that applies, so we're looking for more than one correct option here. Alrighty, it's lots of 2s and 3s, and a couple 1s and 4s mixed in here. Let's jump to our correct answer, and I'm going to walk through this one in full. So we were just looking for 2 and 3. So external radiation therapy, we talked a little bit about this prior, but it's used to treat a number of different malignancies. When talking about radiation safety, the nurse should teach about protection from the sun, things like sunscreen, wide-brimmed hat, covering up, using long-sleeve clothing, long pants. We want to make sure we're protecting ourselves from the sun's rays. Essentially, the skin has already been exposed to the strong radiation beams. We don't want to worsen any existing damage or further irritate the skin by exposing it to the sun's beams as well. Also, a provider-approved lotion is going to be appropriate for the client. Something that's mild and unscented is going to help maintain the skin integrity without irritating it. So 2 and 3 were correct. Options 1, 4, and 5 are not indicated. Exfoliation is going to further irritate that already red, warm skin. We also do not want to put compression on this, and we're not going to do the cold and hot. But again, it's just the long sleeve, wearing our sunscreen, using approved lotions. Alrighty, question 6. The nurse has been advised that a client with tumor lysis syndrome has hyperkalemia. It would be a priority for the nurse to: 1 is administer IV potassium chloride, 2 is initiate continuous cardiac monitoring, 3 is prepare the client for hemodialysis, or 4, monitor the client's serum glucose level frequently. Drop those answers in the chat. Let us know what you all are thinking, and keep letting us know what topics you all want to see. We just covered chronic kidney disease yesterday with our lecture, and now we're doing a couple different question drills. We're going to cover oncology, ECGs, and top it off with thyroid and parathyroid, which actually is a new question drill on Sunday. So super excited for that. Let us know what topics you guys want to see more of, and keep tuning in for our content calendar. Again, that's at uworldnursing.com. You can find everything we plan to present for the next few weeks. Nurse Chrissy asks, how often do we go live? Well, we go live 5 days a week, 7 times a week. So we're live noon on Tuesday with a lecture. We're live at 11 and 7 today, Wednesday, with a question drill. We're back with more question drills 11 and 3 on Thursday, again, all in Central Time. We're live 7 p.m. Friday, 7 p.m. Sunday. If that is too much to remember, you can always check it out at uworldnursing.com. Again, uworldnursing.com, spelled the normal way, and that gives our complete topics so you know what topics we're going to be presenting at what times. Alrighty, some great answers I'm seeing. I'm seeing a lot of requests for pediatrics, maternity, pharmacology. These are great topics, great suggestions. Fundamentals, I like fundamentals too. Fundamentals are actually, I think, kind of hard. Like if you think about doing crutches and explaining that process, or some of the simplest things are the hardest things to describe. So don't sleep on fundamentals. I think they're hard. Alrighty. Lots of great answers. I see a lot about hyperkalemia, and we actually just did a live on electrolyte imbalances specific to potassium last Tuesday. Again, you can visit those on any of our social channels. I think the YouTube one is the easiest one to search. But you guys are on the right track because you're worried about that potassium, and option number 2 is what we are most concerned about. So tumor lysis syndrome is an oncologic emergency. It happens when the cancer treatment successfully works, which is great, but it kills off those cancer cells, resulting in the release of intracellular components like potassium, hint the hyperkalemia, phosphate nucleic acids, which you can think of like uric acid. So clients with tumor lysis syndrome develop significant imbalances of serum electrolytes, specifically that potassium, that hyperkalemia. And we know that this has the potential for cardiac complications, which is why it's our priority to initiate continuous cardiac monitoring. This can progress to VTAC, VFib, lots of really dangerous things here. So we want to make sure we keep an eye on any dysrhythmias that are to develop, which is why we would want to do continuous cardiac monitoring. We are definitely not going to give IV potassium chloride if they're already having hyperkalemia. We do not want to add to that. So again, option 2 is our correct option. All right, question 7. The nurse is planning care for a client who had a mastectomy and has lymphedema of the right upper extremity. Which of the following intervention should the nurse include in the client's plan of care? Select all that apply. So our options are to apply a compression sleeve to the client's right upper extremity, to place a safety alert bracelet on the client's right upper extremity, 3, collect blood specimens as necessary from the client's right upper extremity, 4, perform passive range of motion exercises on the client's right and left upper extremities. And 5, instruct the UAP to obtain blood pressure readings from the client's left upper extremity. So we're looking for things to include. We're looking for correct interventions, but really big teaching point here is look at which extremity the surgery was on. What is the affected extremity? That's the extremity we're going to want to treat very carefully, be very cautious with, hint, hint. So definitely keep that in mind as you answer this question. But again, it is a select all that applies, so we have more than one correct option. In the meantime, we are partnered with NSNA. I hope you all are aware of this partnership. We're so proud to be the official NCLEX prep resource, the proven choice of the NSNA. Through them, we're going to have a really big influence at their spring and fall conferences. We went to Seattle in April. We had a blast. We got to meet so many of you guys, which we absolutely adored. We're going to be back in Columbus, Ohio this fall, which we can't wait for. But we're also doing webinars throughout the year. We do 6 throughout the year. We just finished our 4th about 2 weeks ago, I believe now, 1 week ago. And our next one will be on Monday, September the 8th from 11 to 1 p.m. Central Standard Time. But if you want more information on that, you can visit our social media or the NSNA's social media. But we've had a lot of fun doing this. They're 2-hour sessions. Again, Monday, September 8th is the next one. So make sure you check that out. Mark it on your calendar. All right, lots of fabulous answers coming in. All right, and keeping in mind my warning about the extremity is going to inform our correct option, but the correct options were 1, 2, 4, and 5, so all but 3. So really important teaching point here, the right upper extremity is what we are concerned about. That's where we had this surgery. So a mastectomy is the surgical removal of breast tissue, and it can include the lymph nodes. It's typically part of certain treatments for certain types of breast cancers. No surprise there. When we remove the lymph nodes, we worry about lymphedema because it happens we have impaired lymph drainage because we've removed the lymph nodes due to not having them there anymore. So to lower the risk of lymphedema, we should perform certain interventions, including applying a compression sleeve will help with that. We also want to place a safety alert bracelet on the affected extremity. And the safety alert bracelet, I remember it by the P's, no pokes, no pressures. We want to treat this arm really carefully. And this is the affected extremity, so this is where the safety alert goes. This is where the compression sleeve goes, but we're not doing pokes, we're not taking labs, and we're not taking blood pressures from the affected side. So option number 3, collect blood specimens from that affected side. The right side would be incorrect. This would not be included in the plan of care. Option 4, another correct one. We want to keep those passive range of motion exercises. They're light, they're not the active ones. It's just a little bit to keep the blood flowing, help drain some of that lymph fluid. And lastly, 5, assist the UAP to obtain the blood pressure readings from the left upper extremity. So we are able to take blood pressure on the opposite side, just not the affected side. So again, 1, 2, 4, and 5 were our correct options. Way to go, you guys. All right, question 8, our last one. Way to go, you guys. We flew through this. So the nurse is caring for a client with leukemia who is receiving methotrexate. The nurse should recognize that the methotrexate is administered to, our options are to reduce nausea and vomiting, to prevent hemorrhagic cystitis, to inhibit the division of cancer cells, or 4, increase the number of mature white blood cells. All right, our last question. After we're done here, let us know how many out of 8 you all got correct. From what I can see, you guys did fabulous today. Way to go. Don't forget to follow us if you haven't already, and go ahead and check out uworldnursing.com. I see someone said that the internet messed up and they missed it. Well, good news. We post all of our lives after we do them to all of our social channels as well as our YouTube. I think the YouTube channel, again, I said it a million times, it's the easiest one to search because you have that search functionality. So you can type in whatever you want to learn more about and it will pull up what videos we have on it. So make sure if you missed out, if you dropped in late, had to leave early, no problem at all. We can direct you to the posted version afterwards. All right, lots of answers coming in here. And I see a couple people are also naming other uses for methotrexate. That is phenomenal. There are multiple indications for methotrexate. So way to go, you guys. All right, so I see almost all correct options, so I'm going to go ahead and reveal our answer, and that was option number 3. So methotrexate is classified as something called an anti-neoplastic medication, meaning it's used in the treatment of cancers as one of its indications. It's often used as part of a treatment regimen for certain cancers like acute lymphoblastic leukemia, or ALL, non-Hodgkin's lymphoma, and lung cancers, as well as a few others. So we know that cancer is uninhibited cell division and growth. So methotrexate and other antineoplastic medications work by targeting cells at some point during their replication process to inhibit that step or slow it down to slow the growth of the cancer cells. So option 3 was our correct option. Way to go, you guys. That one did not fool you. Thank you guys so much for tuning in today. It was so wonderful to spend time with you all. Again, visit uworldnursing.com, and we'll be back tonight at 7 p.m. Central Standard Time with Nurse Andrew. So tune in for that. Bye-bye.